Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. Thank you so much for the introduction, Doctor. And thank you to the Society of Simulation for the invitation. And I hope my presentation will... Okay, so my topic today will be designing and conducting faculty development programs during the COVID-19 pandemic. I thought a lot about what I'm going to present today. Will I be presenting how to design a faculty development program, or what are the challenges that we faced during conducting faculty development program? So I tried to mix the two topics together. So I will be talking about what are the challenges we faced when we faced the quarantine after the COVID pandemic broke out, and what are the lessons learned from the literature and from my experience. Of course, I am disclosing that I have no conflict of interest. I am presenting a teamwork from my center, the Simulation and Clinical Skills Development Center in Princess Noor University. Our team made a lot of efforts to conduct faculty development programs and training and maximize the safety of trainers that we take in our center. So faculty development programs are a broad range of activities that institutions and organizations use to renew or assess the faculty in their roles. We talk a lot about topics involved in the faculty development programs. They are professional development, they are career development. They usually target topics of teaching, research, administration, and education. So because they vary in range and the time required for the development programs, we usually divide it in three types. So the short faculty development programs, which involve courses, workshops, and seminars. The integrated longitudinal faculty development programs, which are fellowships and long courses. And finally, we involved also the role modeling or shadowing, which involves coaching or personal coaching and self-directed initiatives. Of course, my topic will involve my experience, and I try to look through the literature about papers that studied the current status of faculty development programs. And what's interesting was a lot of the findings we found in our center were reported in the literature too. So what happened to faculty development programs when the pandemic broke out? My colleagues explained thoroughly all the statistics involved in this pandemics and what the action took by simulation centers, by institutions to address this pandemic, either training or healthcare providers or frontliners. So from my part, the faculty development program, so I'm considered one of the people who are developing and conducting the faculty development programs in our center. So we changed the whole system of how to conduct it. We either done it online or on-site with precautions. Of course, Dr. Mohammed, the speaker before me, details what they did in their center and how they addressed the safety concerns when training participants. We faced a similar challenge in this area. While our center is considered one of the largest centers in the world, simulation centers in the world, what's the challenge we faced is because there are a lot of venues and a lot of classrooms, auditoriums, we had to make a very concise and applicable infection control protocol that can be applied and can be used by our faculty, by our simulation staff, and our trainees. So what we did is we did a study of the already available supplies. We had to quickly address the need for faculty development programs. What Dr. Amira talked about, which is the 5C course, this was our initiative on how we pilot the the infection control protocol. So the task force sat together and tried to find a way to implement the training and to optimize the training while keeping the environment safe. So for lectures, on-site lectures, we try to prepare venues that, for lectures and seminars for the staff and faculty who are not available to come on, to be online. Of course, we have already an annual faculty development programs for Princess Noura University staff or faculty. It's conducted annually by our center, and that's why we transform it to online format, of course, for large scale. Why we did that is because we are addressing 5 colleges, and it is difficult to find a time that's suitable for everyone or the location, and because of the large number of staff involved. Of course, if we are conducting a practical training for the participants, we had to ensure that it's a safe environment. All PPE and supplies and mannequins are prepared, and all participants are informed on how to safely practice and protect themselves. Signage, of course, was placed throughout the center. And of course, when I looked through the literature, every center usually does this, but what we are currently facing is effect of applying those protocols on the personal level. So what's interesting was when I looked at the literature and we spoke with the faculty who are attending those programs, the faculty development programs does not take into consideration different groups. Of course, the pandemic personally affected everyone, but what's interesting was the literature mentioned that women academics and online learning of their children, for example, or someone who they take care of, they find it that the women academic find it very difficult to attend faculty development programs because they don't have enough time or they are very limited in the way that it can attend. So because we are transferring all faculty development programs online, the problem was that we are doing it similar to what we're doing in the conference. It's not pre-recorded. We upload it online as a video, but some of the organizations did not do that, and that was addressed. On the institutional level, the gap in the faculty development programming and how the institutions choose the faculty development programs. Each individual or each faculty have their own goals and their own aim and how they want to develop their career. But the institution has, sometimes some of the institutions have a different aim. They have a different interest. And sometimes those things do not align. So from my perspective as a simulation educator, I want the faculty who attend the activities to be very knowledgeable about how they conduct simulation activities. But when we talked to the faculty themselves, they were saying things like, okay, I'm interested in how to conduct simulation activities, but the topics you're offering sometimes do not cover my needs. I need, for example, for you to offer me more workshops or more faculty development programs on how to do research. While me, as a simulation educator, I was focusing more on the conduction, on how to do the debriefing, on how to develop simulation scenarios. So sometimes the misalignments sometimes happen. And also the institutional usually focus on something we call institutional input. So institutional input is what we want to train our faculty. So our faculty, for example, let's take something outside from the simulation. We want them to know how to write, for example, multiple choice questions. This is very simple, right? But do we study the output of it? Do we take the multiple choice questions developed by those faculty and see, are they good enough, or do they achieve the courses, the outcome of the courses? This is something simply happen when we are focusing always on the input, but the output is not studied. So we don't know if the faculty development programs are working. Of course, after the COVID-19 pandemic, there's a talk or the sentence I always heard, which is never let a good water crisis go to waste, which means we have a crisis now. Thank God our organization, our institution, our leaders gave us all the support and actions, prompt actions, to limit the catastrophe's result. That's why we need to learn from this catastrophe. So we need to reassess the programming of faculty development program to be able to cater to personal career development. We also need to design and conduct faculty development program that take into consideration the faculty that are still affected by COVID-19. Where still most of our children now go through, for example, online learning. Because some of the working mothers are still working with them and trying to monitor this, maybe those are affected. There are also healthcare providers and faculty who are affected by this. So the institution need to study the current situation and develop faculty development programs that cater to their situation, to their needs, and to their time available to attend those faculty development programs. We also need to consider implementing a hybrid method of delivering faculty development programs that are designed based on best practice. A hybrid method is a very interesting approach to teaching or to delivering faculty development programs. So hybrid is basically when you have, similar to this, you have an audience with you, and you have people who are attending online. The assembly is basically what is this method, hybrid method. If you are planning to conduct this method of delivering faculty development program, you need to ensure the engagement level is high, because I think we saw the human factors now, that the technology is affected, so you have to consider a lot of factors, and I will go through it after the slide. We also consider the strategic approach to faculty development. We have to consider the institutional aim, and we have to consider the career development aspect of each faculty involved. And designing faculty development programs that serve the institutional goals that are also based on best practice. I'm repeating this sentence, best practice, because what we notice is when we take lectures and put it online, for example, we are shifting the method of delivering information or delivering learning objectives. Online learning is very different than on-site learning. The engagement is nearly zero, and you have a very unengaged learner. So you have to shift the method of, the learning materials to fit this method of delivery. So if you are considering online or hybrid faculty development program, I tried to make it very the best practice that I noticed and the experience we saw and I found in the previous papers. So if you are considering faculty development programs, you have to consider participants' engagement. So you can use engagements to improve the engagement. You have to use chat rooms or separate rooms to include the participants. Some of the softwares available now, they have a feature that you can put the participants in groups. They will be in a group separate, and they can discuss if you're planning to do a group activity. You can do that using online format. It's already been done, and it's very successful, and it's very helpful for the participant, because now you can make them very familiar with each other, and the engagement will be higher. Of course, all of the literature actually focused on using opening the audio and the face cameras. This was, let's say, to limit the distractions that the participants will have. Because they are online, they will not be available to you. They most likely will put it off, everything is off, and they will listen. Therefore, the engagement is lower. That's why they recommended to let the participants or mandate them to open their cameras and open the audio channels. The second one is technical support. So you have to ensure that the faculty, both the faculty and the participants, have good network. Some of the papers recommended that you provide the developers with softwares and the hardware required to develop the faculty development programs. And for the designing of the faculty development programs, as I said before, you have to consider, because it's online, it's different than on site. The engagement is very low, so you have to redesign it again and consider it, design it using models like ADDIE model or Kern steps, 6 steps. So when you design it like that, you will keep in mind what are the obstacles, what are the challenges, and you will cater more to the methodology of delivery. If you are considering hybrid faculty development programs, online participants and on-site participants, similar to the technical support and designing faculty development programs, you have to redesign all your materials to fit this methodology. The venue itself, you have to ensure, because we are still going through the pandemic, you have to ensure that you have a very strong, rigorous infection control protocol. And for the participant engagement, in addition to the cameras for the learners, you have to keep an open channel of communication between the participants in the site and online. You have to keep it on at all time. This way, they will keep working together. They also recommend that we put the online group with the on-site group, and you have to ensure also that you are doing exercises that can be implemented in this format. So, of course, you can do any practical training using both methodologies of delivery, but those are very useful if you are planning to conduct a training prior to practical training. Those are some of the references I used. Thank you so much for listening.